Morning, everybody. My name is Conor O'Mahony. Before I start, I want to say I really enjoyed the previous keynote talk. I think it gave a really good overview of the challenges and the opportunities that we face in bringing healthcare technologies to markets, where it would make a major difference in reducing the impact on clinical needs. So I am from the Tyndall National Institute, which is a research centre based at University College Cork on the south coast of Ireland. We are a community of about 600 people, including researchers, support staff, and PhD students. And we turn over about 40 million euros a year in research income, of which nowadays about a third of this is in medtech research. So we're seeing a massive increase in industrial and academic research in the area of medical and health and related and wearable technologies. So a major interest of mine is in the development of wearable technologies for drug delivery, diagnostics, and also smart wound care. And this is a really rapidly expanding area. So let's get straight to it. You'll be glad to know that this is the only slide I'm going to show where we actually show pictures of wounds today. But it's important in the context of the subject that we understand what we're talking about. And most of the technology in smart wound care is concerned with chronic wounds, and chronic wounds are defined as those that fail to progress through the healing cycle in a timely manner. And usually this is defined as more than a month, but actually, in fact, many of these wounds never heal. Right? It's a lifetime affliction with enormous implications for economic, social, and clinical factors. And treatment of chronic wounds has a number of major impacts. Number one, they're usually treated in a healthcare setting, so the patient needs to be treated in a hospital. And secondly, we have no way of knowing what is happening in that wound without physically taking off the dressing and looking at it. And every time you do this, it disturbs the wound environment, it regresses the healing cycle, and it's obviously disturbing for the patient as well. So the impacts of chronic wounds are enormous. That the headline figure in the top left is one that always really strikes me. Every 20 seconds, somewhere around the world, a diabetic foot is lost. All right, and that has lifelong implications for the patient and for the clinical system, obviously. And about 2% of the general population have got a chronic wound at any one time, which is much larger than you would think. And many of these patients are hospital bound, and about a quarter of all hospital inpatients have got a pressure ulcer. So on top of their underlying condition, we need to manage these chronic wounds, which really increases the burden on healthcare systems. Now you probably notice that a lot of these numbers are in dollars and euros, and strikingly there's no data available, or very little data available, on the prevalence and the management of chronic wounds in low and middle income countries. And we have plenty of anecdotal evidence that says, for example, that many of the wounds in those countries are actually stemming from acute injuries that eventually became chronic. And we also know that there are growing rates of conditions such as obesity, smoking is a major one, and diabetes that are increasing the incidence of chronic wounds in those countries. And as Louise outlined earlier, we know that the facilities are usually underdeveloped compared to those in high-income countries. And I'll illustrate this with two images below. In these two settings, both patients are receiving identical treatment. The lady on the left is receiving what we call negative pressure wound therapy for a wound in her leg. And this is where we apply low levels of suction to a wound that basically helps the wound heal by mechanically drawing in the edges of the wound, and also by stimulating the cells in the wound to accelerate the healing effect. And you can see she's being treated by a nurse in a nice room. The sky is blue, there are flowers in the window, and everything is nice and happy. And the patient on the right is in a public hospital in Malaysia, and he is receiving exactly the same treatment, except in this case they have taped a simple sponge to his leg. They're applying the pressure by plugging that sponge into the hospital's negative pressure supply in the wall. and they're sucking the fluid from the wound into a plastic bottle that's located on a plastic chair beside the bed. So obviously it's not optimal. The key thing to look at here is that both patients have exactly the same challenges. They're both bedbound, and they're both in a hospital. And what we really want to do now is to develop technologies that allow both those patients to receive that treatment at home and to free up those hospital beds. We want them to be able to return to settings where they are physically and mentally and socially much more at home, and reduce that gap between bed availability and bed demand that we talked about earlier. So how do we do that? It's striking that when you go to a wound care conference these days, you will see a lot of talk about technology, and all of the wound dressings right now involve various technologies. You can see some here. They have SafeTech technology and Cryoform technology and AAA technology and pocket quill technology, and that's not what we think about when we talk about technologies. You know, we think about smartphones and communications and flexible electronics. And the question for us as researchers now is, can we somehow merge these two technologies to make a smart wound dressing? And the answer is that we almost can. There's a huge research effort, both industrial and academic, in this area now. And we define smart wound care as the merger of highly miniaturized electronic and communication technologies with conventional wound dressing materials. And that sounds straightforward, but actually the interface between those textiles and the electronics in a challenging environment that is mobile and often exudating is actually very, very challenging. But we define two kinds of smart wound dressings now. We define a passive dressing as one that uses sensors to detect parameters like dressing saturation, infection, and healing rates, and so on. And this dressing would wirelessly send an alarm condition to the nurse or to the caregiver when, for example, the wound became infected or when the dressing needed changing. So you could envisage a scenario where the patient went home and came back to the clinic only when the wound needed attention or when the dressing needed changing. And then we have active dressings that will use energy sources to somehow treat the wound, and this includes stimuli like positive and negative pressures, electrostimulation, optical treatments, and so on. And both scenarios need the development of technology platforms to make this a reality. Things like flexible electronics, we need wireless communications, we need low power, and so on. So let me give you just a couple of brief examples of what I'm talking about when I talk about smart wound care. This is the one on the left is a passive dressing that was developed in my own team, where we embedded Bluetooth, we embedded an accelerometer, a flexible battery, and flexible electronics to a standard wound dressing with the intention of tracking the exudation rate across the wound foam, the dressing foam, I beg your pardon, with a view to, again, alerting the caregiver when the wound dressing became saturated or dirty and needed changing. And this would prevent the caregiver from needlessly checking the wound dressing at a time when it didn't need to be checked, right? And therefore we could reduce the frequency of dressing changes, and overall we would save on clinical time and effort. And the image on the right is of a similar smart dressing being developed by German company Karl Otto Braun and Fraunhofer in Munich, and they are embedding 10 flexible pH sensors, which is a long brown strip you can see in the middle of that dressing, with dressing materials, with a view towards monitoring the pH of the wound, because pH is a clinical gold standard that tells the caregiver at what stage of the healing cycle the wound is at. So those are passive dressings, and then we have active dressings, which, as I said, use kind of a stimuli to heal the wound. Here's some examples. The one on the left is from a company called Elastomed that uses shape memory polymers to compress the wound, and this is primarily for use in venous leg ulcers. The one on the bottom left is a research grade device that applies low levels of current to a wound, and this is a technique that we call electrostimulation. The Medilite device was developed as part of a European project, and this utilizes the power of blue light to stimulate the cells in the wound and accelerate the healing process. And the bottom right shows you a compression device also for treatment of venous leg ulcers, where we employ an emerging technology known as micropumps to inflate a cuff around the leg. So there are many trade-offs when we talk about smart wound care, and again, Louise began to touch on some of these. We know, for example, that these are going to cost quite a bit more than conventional dressings, and therefore we have to make the procurement agencies and the end users well aware that the downstream savings will be much more than the upfront costs, and I think is a challenge for us. There is also a challenge in getting the end user to successfully deploy and use these dressings in the field. And again, we need to really interact with the end user at a very early stage, and we need to make sure that design engineering techniques are employed to make sure that the devices are as easy to use as possible. One of the things that's really in our favor here, in particular in low and middle income countries, is the prevalence of smartphone penetration, which is over 90% now in most countries. And that does give us a familiarity with technology, and it definitely allows us to connect the patient with the clinician in a manner that they're familiar with right now. So as I mentioned earlier, the costs are enormous for smart wound care, right? So in Europe, treatment of a patient with a severe pressure ulcer costs well over 100,000 euros. In Ireland, the cost of a hospital bed for a year is over 300,000 euros, and I assume it's the same in most developed countries. In low income economies, that bed may not be there. And, you know, again, if you look at some of Louise's costs, or Louise's data where she showed that gap between the bed availability and the bed demand, some patients clearly are not getting treated optimally. And significant human and social problems arise from chronic wounds downstream. You know, people often are unable to work. They become a burden on the family. They have mental issues, and really we need to become aware of the downstream savings that we could secure by bringing smart technologies like this to the markets. If you want to delve more into the technical requirements for this, because I haven't really done so today, I'll point you towards the Healthy website, and also towards the ECS strategic agenda for 2021, where they talk about the needs for smart wound care, things like flexible and low profile electronics, advanced manufacturing techniques, materials, communication technologies, and edge AI. And again, the previous speaker touched on this. We need to find ways of gathering and managing data in a way that's actually useful for us, so that we can do something with that data. So the next steps are challenging but positive, I would say. So at the outset, we know that flexible and printed electronics are really developing very, very fast now. That's a great help to us. Environmental issues, not so much. A big challenge with smart wound care is that when the dressing comes off a patient, it's hazardous waste. So therefore, it must go in the incinerator, and all of the power and the circuitry and the components are also incinerated, and that's not ideal for us. We need to consider ways of reducing that. One of the ways in which we can do that is by using so-called paper batteries. These are soft, flexible batteries made by eco-friendly materials, and that really is a very promising development. As I mentioned earlier, the merger of electronics with textiles is challenging, and by that I mean we need to understand how they are used in a wound care environment where the textiles are often becoming wet and soiled, and they're swelling and they're changing with motion and so on. And it's quite difficult to to understand the interaction of those textiles with the sensors that we embed in the electronics. I mentioned briefly earlier that we need human factors engineering. We need to make these devices as fail-safe as possible to use, both by the patient and by the clinician, and especially in low-income economies where education levels might be an issue. This is particularly important. But we will be aided there, as I said, by the increasing levels of smartphone penetration and by 4 and 5G internet coverage. So it's a really challenging field. It's very multidisciplinary. We're not going to do this by ourselves, and I'm going to issue a shameless call for collaborators now. At Tyndall, we've begun to realize that we can't do this by ourselves. We're not good at everything, and so we're setting up what we call an ABCD ecosystem for healthcare technologies, where we combine academic research institutes like ourselves with the companies, the businesses who will make and sell these devices, and we are rapidly growing a network of clinical personnel who will inform us at the outset of what we need to implement in our technologies. And we're using design engineering companies to help us make these user-friendly at the very, very beginning, because a typical flaw that we see or have seen in the past is that what the academic and the research provider thinks someone needs maybe is not what they need after all. So we want to cut off that error as soon as we can. So, despite challenges with Brexit and so on, there are many ways in which we can work together across the UK and Ireland and across Europe. I will, for those of you who are not aware, our Irish funding body, Science Foundation Ireland, works very closely with the UK bodies EPSRC and BBSRC, where the two agencies will jointly fund a project across the two islands. And in this case, we jointly apply to the UK funding agency. They will fund a UK project, and the Irish authorities will fund an Irish project. And the end result is that you actually wind up with an overall project that's twice as large as would be funded by any one body on itself. So we're always interested to hear from UK partners who might be thinking about applying to these funds, and we can, as I said, double the effort in the project. For those of you in the north of Ireland, there's also a US-Ireland research funding program, which is very attractive for us, where a body in the south of Ireland, a body in the north of Ireland, and a body in the United States comes together to fund a project, again, that would be 3 times the size of any one project in any jurisdiction. So I'd be happy to talk to anyone about that in the future. So I'm going to wrap up there. That was a whistle-stop tour of our thoughts on smart wound care. I just want to thank the funding agencies and the companies that we're working with in this area, and I'd be happy to take any questions from you as well. So thanks for your time.